Turning 65 can bring a lot of Medicare information all at once. You may be hearing about deadlines, different types of coverage, prescription drug plans, doctors, pharmacies, and what happens if you are still working. It can feel like you are supposed to understand everything immediately. You are not. The best first step is not to rush into a decision. It is to get organized around the questions that matter to you. This video is a simple Medicare planning checklist. It is general education, not a plan recommendation, and it is designed to help you prepare for a clear conversation when you are ready. Start with timing. For many people, the initial enrollment period begins 3 months before the month they turn 65 and ends 3 months after that month. That is an important window to understand, but it is not a reason to make assumptions about your own situation. Timing can be affected by things like other coverage, work status, or special circumstances. The practical takeaway is simple. Put your 65th birthday month on your calendar, give yourself time to learn, and ask questions before timing becomes stressful. Good planning is not about rushing, it is about knowing what applies to you. If you or your spouse is still working and you have health coverage through an employer, that can change the conversation. Before you make a change, learn how your current coverage coordinates with Medicare. Your benefits administrator or human resources team can help explain your employer coverage and when it is expected to end. If you are planning retirement, it also helps to understand the dates before you leave a job instead of waiting until the last minute. The key message is not that one answer fits everyone. The key message is that job based coverage deserves a careful, personal review. Next, gather the details that make a Medicare review useful. Make a list of your doctors and specialists. Write down the prescription medications you take and the pharmacy you prefer. Keep your zip code and a copy of your current coverage information nearby. Then write down your questions. You may want to understand how your current coverage works. You may want to check your prescriptions or your providers. You may be preparing for retirement, or you may simply want a clear explanation of the choices in front of you. Bringing real information turns a general conversation into one that is focused on your actual needs. Your healthcare routine matters. Medicare choices are not just about a name on a card. Your doctors, specialists, medications, and pharmacy are part of the picture. When you compare options, it is reasonable to ask whether your providers and pharmacies are included, how prescriptions are handled, and what costs you should understand. Do not assume that one person's answer will be right for you. Your care routine is personal. A careful review starts with the providers you see, the medications you use, and the questions you want answered. Costs are another important part of the conversation. It is helpful to look beyond a single monthly number. You may want to understand premiums, what you pay when you receive care, prescription costs, and the estimate of your yearly costs based on your own circumstances. Avoid making a choice based on a headline or an advertisement alone. A Medicare review should help you understand what you are comparing and what questions to ask. It should not promise savings, make assumptions about eligibility, or pressure you into a decision. Clear information is more valuable than a quick answer. Medicare is important, and it should be treated that way. A good educational conversation should leave you with more clarity, not more pressure. You should understand what information matters, what you still need to verify, and what your next question should be. Be cautious about anyone who makes a broad promise before they know your circumstances. Your health needs, your budget, your providers, your prescriptions, and your coverage today are all personal. The goal is not to make Medicare sound simple for everyone. The goal is to make your own next step clearer. Here is the checklist to save. First, know your timeline. Second, understand your current coverage. Third, if you are working or covered through a spouse, talk with the benefits administrator. Fourth, make your doctor and prescription list. Fifth, Note your preferred pharmacy and zip code. Sixth, write down the questions you want answered. And seventh, give yourself enough time to have an educational review before you feel rushed. This checklist does not replace individual guidance, it gives you a stronger place to begin. If you are approaching 65, planning to retire, or preparing for a change in job based coverage, start with your questions. Gather your information, take your time, and ask for education that is focused on your situation. Our team can help you prepare for a Medicare review when you are ready. This video is general educational information and is not a plan, recommendation, or an eligibility determination. The best next step is a clear, personal conversation built around the information that matters to you. There are two more practical habits that can make Medicare planning easier. First, keep your information together. A folder, notebook, or secure digital file can hold your current coverage details, prescription list, provider list, questions, and any Medicare materials you receive. When you have everything in one place, you can come back to the conversation without relying on memory. It also makes it easier to involve a spouse, a family member, or another trusted person if you choose to do that. Second, remember that planning is a process. You do not have to understand every term on the first day. Start with the questions that are most relevant to your situation, then verify the details that matter before making a decision. If your health needs change, your prescriptions change, you move, you retire, or your employer coverage changes, those are good times to review your questions again. Staying organized helps you respond to changes without feeling rushed. The purpose of a Medicare review is not to replace your judgment, it is to give you a clear, structured way to understand your choices and the questions that deserve attention. Start early, bring the information that matters, and ask for explanations in plain language. The more clearly you understand your situation, the more confidently you can make the next decision that is right for you.